Since breast cancer is very common in our society, let us know more about early detection methods. I am Akanksha and we have Dr. Srinivas Prasad from Horizon Cancer Care, Hyderabad. Hello, doctor.
Hello, Akanksha. Hello, everyone.
So, what is breast cancer screening?
Right. Breast cancer screening is checking for breast cancer before any symptoms show up, like lumps, nipple discharge, skin thickening, etc.
Why should women get it done and what are the benefits?
Most important is early detection. It finds the cancer early, which makes it easier to cure, and also less intensive treatment. Early detection means treatment can be less intense, reducing the emotional and financial stress. Breast cancer can be treated with various methods like surgery, chemotherapy, radiation therapy, and hormonal therapy also. When detected early, the need for multiple treatments can be minimized or avoided. If cancer is found only after symptoms like lumps or skin changes appear, it might be more advanced and requires more treatments, leading to higher cost and more emotional impact also. These treatments can cause pain, side effects because of the treatments, depression, and a long treatment periods can affect the self-confidence and also leads to social pressures. By choosing early detection through screening, women can avoid these challenges and increase their chance of successful treatment with least impact on their lives.
What are the different methods of breast cancer screening?
Okay. First is the breast self-examination. Means women have to regularly perform self-examination monthly, preferably a few days after their menstrual cycle ends. For any lumps, changes in the size of any pre-existing lump, or any unusual skin conditions. It helps them to become familiar with their breasts and notice any changes easily and early also. The second method is clinical breast examination. It's an examination of an individual by the doctor who checks for lumps or other signs which we described earlier. The third is mammogram. Mammogram uses a low X-rays to screen the breast lumps that can be detected very early.
So, when should one start screening?
Yeah, women should start monthly breast self-examination from 20 and continue. For women aged 25 to 40, without any hereditary risk or other risk factors, a visit to the doctor for clinical examination once in 2 to 3 years should be sufficient because the risk in this age group is very less. But women over 40, yearly examination by a doctor is essential. And coming to the mammogram, uh, it's under 40, it's not a very useful for women to because their breasts are very dense, where we can miss small lesions which are not seen very properly. But after 40 to 45 years, mammogram becomes a more effective modality. So most guidelines suggest getting a mammogram every year, but doing it every alternate years is also okay. That is once in 2 years also okay.
So, then under 40, what tests should be done?
Ultrasound is an investigation which is very safe and reliable also.
Is the same schedule to be followed by women who have a history of breast or ovarian cancer?
Annual mammogram should start from the age of 35 because the hereditary cancer, the breast cancer may start early. Sometimes to avoid radiation, we may recommend an MRI instead of a mammogram.
Is mammogram a safe test?
Yes, it is. The radiation exposure from a mammogram is very minimal. For instance, the amount of radiation you are exposed during a mammogram is roughly equivalent to what one experiences from the environment over a week. So, it is safe.
Is it painful?
During the procedure, the breasts are compressed between the two plates. That can cause mild discomfort and sometimes mild pain also, but it's very insignificant. So, it is safe.
Can women above 40 directly go for mammography?
No, please don't do that directly because mammography has its own pitfalls and it is very essential to read the report correctly, especially since it is common to find small non-cancerous conditions on mammography. So, if you do on your own and don't know how to read the report, it will be a source of immense anxiety and pressure. So, it is best to consult the doctor.
So, which doctor should we go to?
They can consult a surgical oncologist, then it's fine. Otherwise, a surgeon, a family physician, or a gynecologist, they can consult for a mammogram.
Are there any alternatives to mammogram?
Yes, there are non-contact, no-touch breast screening options are available, which are more comfortable, pain-free, and less invasive. Due to the increased blood flow and metabolic activity in cancer cells as well as the cancer lumps, they have a higher temperature. These are captured by the infrared technology. These images are analyzed using artificial intelligence algorithms, and they give a report whether it's a cancerous or non-cancerous. So we have two machines are available. They are Niramai Thermalytics and no-touch breast scan machines.
So, what are the advantages over conventional mammogram?
There is no contact, so no touch, there is no compression, it's absolute privacy is there, suitable for all ages, there is no radiation, more effective in women who have dense breast. They are very useful in that, especially in women who have family history of cancers, who have hereditary cancers. We may be advising yearly mammogram from the age of 35. In this subset of population, subset of women, you can use these no-touch techniques where the radiation to the breast is less compared to the mammograms. So they are very useful.
Thank you so much, doctor, for the information. And as we know, breast cancer is so common, I would request all you women to go for regular screenings. For further assistance and details, kindly contact the details given below. Thank you.
Thank you. Thanks, everyone.